So far, there have been 9 deaths related to dengue fever. A majority of these deaths were people over the age of 55 years. The World Health Organization says that dengue fever, if we have access to medical care, then the number of deaths should be below 1%. And the current rate with 9 confirmed cases is 0.3%. With me tonight to talk more about this is Dr. Alisha Sahu Khan, National Advisor for Communicable Diseases, and Aminiasi Tawui, Acting Senior Health Inspector at National Vector Control. Thank you very much for joining me this evening. So, one thing that I wanted to touch on mainly was the cleanup campaigns that we have going on. Now, dengue is nothing new to the country, and I'm pretty sure that everyone by now are familiar with the symptoms. The Fight the Bite campaign, how is that going?
Well, thank you for the question. Basically, the Fight the Bite campaign was endorsed by the government, so cabinet. So it's going on biannually.
Annually.
So it's going to happen in like 2 times in a year. So for now we're having the first one for this financial year, and one next year.
And these are between the months of November and April.
April. Yeah.
But given with like what they had spoken on climate change, are those months likely to change? The breeding months for dengue fever, for the mosquitoes rather?
Yes, we might change the days of having these cleanup campaigns, but definitely we are having it at the moment, right here and right now as we speak. There's a launch happening in Nusori Primary School, where the Assistant Honourable Minister for Health is officiating in that launch, and that is for the Central Division. We've had the one for the Northern Division last week, and all this is happening in this month. So this is the cleanup month for Fiji.
Is it likely to change? Like, would it be somewhere between mid-year, coming towards the end of the year, you feel? Or have you done any research to indicate that the months would either be longer or shorter?
Well,
the breeding season for the mosquitoes, that is.
The thing is, we'd rather act proactively
Proactively, yes.
before there's an outbreak. So this is normally the period that we do clean up, and then right towards the mid-year we have another one. So there's like one at the beginning during of the season, which is November, and we'll have another one probably before April. But once we have the dengue like cases spiking up, that we need to have cleanup happening almost all throughout the month. You know, it's not something to say that you can just do it biannually or as a rostered cleanup campaigns, but it's just doing it for the sake of reducing transmission of dengue fever in our country. So we cannot say that you do it now or middle of the year. It can happen anytime, as long as we have funding, as long as we have justification to do it.
Yeah.
Then we'll have cleanups. But Ministry of Health has also always been saying that it's our daily routine. It should be part of our life, that we do clean up, in our communities, wherever we are, not necessarily in a particular time of the year. So cleanup campaign has to go on.
So not only is the Ministry of Health creating awareness, but you're also holding activities for cleanups for communities. And so what other communities have you focused on throughout the country?
It's everybody.
Everybody.
Because dengue fever does not affect any particular person. It cuts across gender, ethnicity, every age of people in our community. So basically, we are trying to ask the people of our country, all these Fijians, to please tag along and let us work together in fighting the bite for dengue fever.
Now, Dr. Alisha, one thing that I just realized when doing research on dengue fever was that there were 2 types of dengue fever. Am I right? There's a dengue, or 2 different strains.
There are actually four strains of dengue
strains.
fever. Yep.
Oh, okay. Then obviously I need to do a bit more research. Could you please brief me on these 4 types of dengue fever?
Okay. First of all, thank you very much for having us here today. We really appreciate the chance to increase the awareness on dengue fever in Fiji. So with relation to your question on 4 types of dengue fever, yes, there are 4 strains of the actual virus.
Yeah.
What this means is that if you get dengue fever, you will be infected by that one strain. And in the future, once you've recovered, you will become immune to that strain, but not to the other ones. That is why someone who has had dengue fever in the past can actually get dengue fever again. And the thing is, when you have the second bout of dengue fever, you have a higher risk of contracting the more severe form of the disease.
Which is, what would the name be for?
So it's either called severe dengue, or in some circles it's called dengue hemorrhagic fever. And this is the one where I'm sure you have it in your information that, you know, when someone has dengue fever, most of the time it can be treated at home.
Yeah.
So first we advise people that if you suspect you have dengue fever, if you're sick, please seek medical care. Please see a doctor so that they can assess you to determine whether you do have the severe form of the disease. And if they tell you that you can actually go home and take care of yourself at home, you need to be aware of the danger signs. And so when these danger signs come up, that you know to immediately go back to your healthcare provider.
What are the danger signs?
So the danger signs of severe dengue include symptoms of bleeding. So this could be abnormal bruising. So if you have not had an injury and you're finding that you're having bruising on your body, even if you're bleeding from the mouth, any signs of bleeding. Also, if you're just feeling very sick and it seems like you're just not getting well, and you can tell when someone is very sick, that then you need to go back to your healthcare provider.
So you spoke on the bleeding. When they do know, once they start developing symptoms, what is, how long do they have in terms of getting treatment and surviving to, I'm assuming, is fatal death?
Okay. Not everybody with severe dengue
Yeah.
will actually pass away. We are very fortunate in Fiji that if you get adequate,
Yeah.
acceptable medical care, your chance of actually dying from dengue is quite low.
No.
The people that actually pass away from dengue, we tend to have other conditions as well that weaken their immune system.
Oh, okay.
So we tend to see this in the elderly especially. So the good thing in Fiji is that we have access to that medical care. So as soon as it's recognized that you have severe dengue, you need to present straight away to your
someone with a
medical provider.
pre-existing condition getting dengue, it would be much more fatal for them.
Yes, especially people in the extremes of age. So
Yeah.
the elderly or the very young, they are the more likely ones to have the severe form, but also to suffer even more badly or to pass away because of the severe form of dengue fever.
Thank you for that, Dr. Alicia. We'll just go to a quick break now and we'll be back. You're watching For the Record. Good evening and welcome back to For the Record. Now, in the beginning of this year, rather in May, Dr. Kama had, who was then the National Advisor for Communicable Diseases, had said that there was an outbreak with dengue, and he called on the public, to clean up. There was a need to clean up because of the cases that were rising, and there were around about 932 cases back then. This year is 2,632 or 34 cases. Now, I understand there's some confusion. Is there still an outbreak concerning dengue fever?
Thank you for that question. I would like to say that the outbreak has been called off. The reason is that the outbreak period, we actually noticed in March this year an increase in cases, and by May, the case number had actually passed our outbreak threshold. So that is when the outbreak was called, was in May this year.
What is the outbreak threshold number?
It depends on season.
Okay.
So we have a seasonal variation with dengue fever, as I've mentioned before, and it's based on previous years' numbers. So once a number of cases passed this threshold, the outbreak was called. And at the very peak of the outbreak in May, we were having about 200 cases a week.
200 cases?
200 cases a week. So it was definitely an outbreak during that time. But in recent months, in at least 3 months, this has gone down below the outbreak threshold. So the outbreak has been called off by the Permanent Secretary for Health and Medical Services, and currently we're getting about 6 cases per week, which is our expected level for this time of the year. But we at the Ministry of Health and Medical Services, we recognize that the rainy season from November to April every year is our high-risk season for dengue fever outbreaks, which is why we are being proactive and encouraging the public to clean up now. And not just now, but to make it a regular part of your routine. So we need you to be doing this every week. That if you have empty containers out in your yard, if you have drums that are filled with water in your yard, we need you to clean them every week. It's not just that we have a cleanup campaign now, that you need to clean up just for this period.
Yeah. And how active was your unit during the outbreak season?
Well, we also want to thank the municipal councils for working together with us along during this during the time that we had the outbreak. So what we normally do is like we facilitate and provide the machines for spraying. But again, let me emphasize that's not the solution. That's the end of the side of the things that we look into. It's basically the source reduction. So, as like Dr. Saukanis just mentioned, it should be a weekly thing. Yeah? So, it should be part of our life. This message of cleanup has been there, for decades, and we will continue to advocate on this, on the importance of cleaning up our environment to destroy all breeding places of mosquitoes, because these mosquitoes, they thrive well in places around houses or inside as well. Because this mosquito, that Aedes aegypti mosquito that spreads dengue, thrives well in urban settings. So basically, we are telling people, all Fijians, to continue cleaning up, not just for this month, but it should be part of our life, that we need to continue doing our cleaning up. And during dry seasons, we have something that we call a diapause, where eggs do not hatch. So we've had the outbreak during May, and then it went on, and then all of a sudden there was a dry season. These eggs are there. Now we are witnessing this rainy season. The eggs will hatch as soon as this increased level of water in our surroundings. These eggs, as soon as the water touches it, because they could be infected eggs, So as soon as they're just waiting for water to hatch. So this is when they hatch, and that's why we are doing this cleanup campaign. So that's why we need to do our cleanup a lot now, because we'd rather act now before it's too late.
And clearly, majority of this with mosquitoes finding breeding places has to do with people's behavior when it comes to littering. Is the ministry working in any way with policymakers to try and ensure that penalties in relation to littering, from the public side? Is there a way that they could try and reduce that? Because this is causing drains to clog rather. Rubbish is just rife throughout everywhere in the country. And obviously this is clearly contributing to the number of dengue cases. Are you aware of any such move by the ministry?
Yes, at the moment we are currently reviewing our Public Health Act, which we have emphasized the importance of increasing the fines, so that Because it's again the behavior of people we need to change.
Yeah.
So it's not punishing them with fines, but we need to change their behavior,
Yeah.
because it's been happening all throughout our lifetime. Even when we grew up, we saw people throwing, littering everywhere. So it's people, like our kids will be seeing that as a norm, like in their life. So I think it's while we have legislations to control, like fines, but we need to still change the behavior of how people live.
There was something I found very interesting, and I only learned this a couple of weeks ago. If someone has dengue fever, they're not supposed to be, they should not be taking antibiotics, because it could make it worse. Is that right?
Dengue fever is caused by a virus. So as I was telling you before, there's 4 different types of the virus, but viruses are not affected by antibiotics. So we do not recommend that you take antibiotics if you have dengue fever. The recommendation is for rest, making sure that you're taking lots of fluids and paracetamol, and avoidance of medications like aspirin or ibuprofen or any of those. The only pain relief we recommend for dengue fever is paracetamol, because other types of painkillers like aspirin could actually make bleeding worse in people who have severe dengue.
And my understanding is aspirin is something of a blood thinner.
Yes, exactly. And so the last thing we want is to introduce a blood thinner for someone who has dengue fever.
I definitely want to talk more about that. But we'll go to a quick break, and then we'll be back. You're watching For the Record. Good evening and welcome back to For the Record. Now, Dr. Alicia, we were talking about antibiotics, paracetamols in relation to dengue fever. The reason why I brought that up is because a friend of mine, a couple of months back, had gone to see the doctor, and a private doctor, mind you. They had told him that he had the flu. Now, they prescribed him antibiotics. Even though he said he felt body pains and everything, doctor said, it's the flu season, you've got the flu. Prescribed him the drug. He went home. Clearly he wasn't feeling well. He got worse, went to hospital, and the same thing happened there. The doctors at the hospital told him that he had the flu. Now, it was later on until they tested the blood, because he insisted he get his blood tested, that they realized that he had dengue. Now, what would your advice be to someone going through something similar in this particular case? If the patient feels that there's something wrong with them, and if they feel they don't have what the doctors are telling them, what's your best advice you could give?
Well, in that case, I would recommend patients to get educated about diseases and their sickness. I think as doctors, we really appreciate when a patient is very interested in their own health.
Yeah.
And looking into how they can actually better their own health. If you're not happy with your healthcare provider, I would recommend that you seek a second opinion.
That's the best.
And you are the main custodian of your health. You are responsible for your health. And if you're not happy with your diagnosis, you are free to seek a second opinion regarding that.
Could you give me another thing I want to touch on? Could you give me the relation between dengue fever and climate change?
Okay, I'm glad you brought that up. The link between dengue fever and climate change has been proven in the international scientific community. Recently, there was an article published by the very world-renowned Lancet journal, based out of the UK, just at the end of October, where they actually found that climate change or increasing temperatures actually increases the period for when a mosquito is infectious, an infected dengue mosquito. So it's actually increasing the time period where dengue mosquitoes can infect another person.
Does the same go for chikungunya and Zika?
Yeah, so these are all known as climate-sensitive diseases. So the way the virus actually grows in the mosquito is affected by the temperatures.
By humidity.
Yes.
And given that it's been very hot lately for the past few months, that would explain the increase in dengue cases.
Yes, and I just want to say that we have noticed at the Ministry of Health that the frequency of outbreaks in Fiji of dengue fever is increasing. So in the past, maybe 30 or so years ago, we would notice outbreaks every 5 to 10 years. Now in the last 10 to 20 years, we've seen outbreaks every 2 to 3 years. So there is definitely an acceleration in the amount of outbreaks we are having. This could be due to a number of factors. One of them is that we know that the dengue mosquito is an urban mosquito. It likes urban environments. It likes to feed off of people who live in urban areas. So of course, we're having an increase in population. We're having an increase in the urban population. We know that is a factor. However, we are also seeing changes in our weather. So a point that I had made earlier is that the peak of this dengue fever outbreak was in May, which is outside our traditional high-risk time of the year, which is November to April every year. So we are definitely seeing a change in our weather patterns and a correlating change with our outbreaks of dengue fever. The first recorded outbreak of dengue fever in Fiji was in the 1940s, and this was actually diagnosed as dengue fever. The tests were available way back in that time, so in the 1940s. And then the next outbreak after that was in the 1970s. There was quite a big amount of time before there was another outbreak. And then in the 70s, we had outbreaks in 1971, 1975, and then later on. So it was always a period of around 5 years, and that has been the norm. But then in the last 20 years, we've noticed the frequency has actually increased.
So both biggest contributing factor, climate change and human behavior, with the way people pollute in this country. What can you tell us about your findings so far in relation to the cleanup campaign, what you've noticed around the country? Like, in terms of providing assistance, which were the most badly affected areas in cases of dengue? That had the highest
number of cases. Well, we from the cases that we've been receiving from labs, tests done, there were lots of cases in the Central Division and also in the Western Division. Although there were cases in the North, but then Western and the Central Division was the most affected divisions.
Can dengue spread from one person to another, or is it just solely by mosquitoes?
Okay. So the way that dengue fever is transmitted is, first you need one person who is infected with the virus first. A mosquito, the dengue-carrying mosquito, which is Aedes aegypti predominantly in Fiji and also Albopictus, will bite that person, and then there's a period that's about 10 to 12 days where the virus is actually growing inside the mosquito. After that period, it is infected and it can go and bite another person, and within a period of about 7 days, that person will start to show symptoms. So there is no direct person-to-person transmission. There has to be that dengue-specific mosquito in between.
Okay. Thank you for that. We'll just continue shortly after this. We'll go to a quick break and then we'll be back. You're watching For the Record. Good evening and welcome back to For the Record. Now, Dr. Alicia, things like goat milk, pawpaw leaves have been used, or a lot of people have been said, is another holistic approach to dengue fever. Is this something that the Ministry of Health condones?
The Ministry of Health, together with the World Health Organization, currently does not recommend, I think it was goat milk or pawpaw leaves,
kiwi fruit,
or kiwi fruit for the treatment of dengue fever. The reason is that there is currently not enough evidence to support recommending these for treatment. Everything that we put out to the public in terms of recommendations for these sort of diseases is backed by a lot of international studies and evidence, and currently we cannot recommend based on the current evidence that is out there.
We had spoken about how those who are well, those who would be severely affected would be the elderly or with a pre-existing condition. Are there any other people that would be, or are there any other people that could be affected by dengue in terms of like severe infection?
Well, I just want to point out that anybody can get dengue fever. It doesn't discriminate based on age or sex or ethnicity. Anybody can get dengue fever. Anybody can get the severe form of dengue fever. It's just that people in the extremes of age, so the elderly and people who have other diseases that have weakened their immune system, are more likely to not be able to fight off the disease as much as a healthy person. So this is often where we see our deaths in these populations, people with compromised immune systems. However, that does not mean that a young, healthy person cannot get severe dengue and also pass away. It is that severe of a disease, severe dengue, that can also happen.
How does it affect the body? Like, what exactly does it do to break it down to reach that severity?
So the main symptoms of severe dengue that we want people to be aware of are the bleeding symptoms.
Yes.
So if you notice, if you have been diagnosed with dengue fever, or if you feel sick and you notice that you're having abnormal bruising that you cannot explain, if you're bleeding from your mouth or anywhere else, you need to see your medical provider to be assessed.
So if they were not to seek help, how would the disease continue in its course? Like, how would it affect the body? Would it start affecting the brain? Would it start affecting the organs? Could you give me a rundown on that?
Yeah, so with severe dengue fever, basically the body goes into severe organ failure. You have bleeding not only externally but internally as well, and it is a very severe course of illness, and they die because of bleeding.
Bleeding out, yeah?
It's usually internally that it happens, and then they have issues with their breathing as well. So this is the very severe forms, and as I've explained before, it is quite rare in Fiji. The WHO says that if you have access to good medical care, then the rates of death during an outbreak or even in normal times should be below 1%. If you don't have access to good medical care, it can go up to 20%. So in Fiji, during this outbreak, we've had 9 deaths, but the rate is at 0.3%, which is an indication to us that we do have good access to medical care.
So in other words, once they start exhibiting the symptoms, go see a doctor immediately.
Exactly.
And out of these 9 people, how many of them were in their 50s? Would you know the...
So as I've mentioned before, the majority of them were in the age group of 55 and over.
55
So 5 of them were, one of them was in the age 55 to 65, and 4 of them were above 65 years of age.
So apart from the cleaning up campaign that you've got going on, what other preventive measures have you been teaching the community?
Well, it's basically, apart from source reduction, they can use repellents that has the DEET.
DDET?
DEET. So DEET ingredient in that repellent. That's the one that we are recommending.
And that can they be found in most repellents for mosquitoes?
Yes, it's just the one that we have in the supermarkets.
Supermarkets,
yeah. So that with mosquito nets when they sleep, and also mosquito coils. Apart from doing the source reduction around their surroundings. Yeah.
And what about for those who might find it difficult purchasing those repellents? Are there any other ways that they could make something at home, or you know what I mean, like create something out of products that they have at home to ward off mosquitoes. Are you also teaching the community certain things like that, like DIY things?
Not that we
Or you haven't gone into
we do that currently.
Yeah.
It's a good thing to look into.
Mm. Now, with the outbreak being over, and it is the month of November, are we looking at more dengue cases? I mean, would you say that an increase will happen again between now and April? Or does that all depend on what happens with the communities?
Thank you for that. As I've mentioned, this is our high risk period, so we do expect more dengue cases during this period than any other time of the year. However, our rates right now are below the outbreak threshold and at the level we expect for this time of the year. But the Ministry of Health we're trying to encourage the public to begin preparations now to clean up and make sure that you're cleaning up every week now so that we can prevent another outbreak from happening.
Well, we'll continue that shortly after this. But right now we'll go to a quick break and we'll be back. You're watching For the Record. Good evening and welcome back to For the Record. Now I wanted to ask you on the cleanup campaigns you've done. It's going on within this month, and you were saying that you've already targeted a few locations. Right now you're in Nosori, or
this week we're having the launch done for the Central Division.
the Central Division.
And it's held at the Nosori Primary School, and that's where all the students and the community comes together with the Ministry of Health and other government ministries with the assistance of the Commissioner Central. And they're having this launch, so it's a kickoff for the Central Division.
Does this mean you've completed, it's the kickoff for the cleanup campaign, that is it?
Yeah, the North, they've had it
They've
last
done
week.
this already.
They've done that, so then we'll have the Western
After
sorry,
those
yes, this, and then it goes on. So in during this month, we'll be having launch of cleanup campaigns in all the divisions.
And if members of the public wanted to get involved within these locations, certain locations, how would they go about it? Who would be the contact person? How would they? Is there someone within? Have you identified people within the communities to handle the dissemination of information concerning cleaning up within the communities?
Yes, so we have staff, ministry staffs based in all these divisions that are working along with the DOs and the commissioners and other government departments. So they have, like, the plan is to have the cleanup down to the division and then to the subdivisional levels. So they have the plan set for the month in all these areas. So if they need to know where to go to, they just go to the nearest rural local authority or health office, which is based in all the districts.
And if you could give one advice to the public concerning dengue and prevention, what would it be?
It would be the old saying, just keep your surrounding clean, destroy all breeding places for mosquitoes, which includes pot plants in houses, gutterings, we also have tires lying around our surroundings. If they are areas where they have drums where they store water, if they could just cover it with nettings, so just to prevent mosquitoes from breeding in those areas. And basically, because this, as we've mentioned in a previous segments, is that they thrive well in household surrounding. For Aedes aegypti, for albopictus, they thrive in shrubs, which is also a close proximity to where people live. So these two, like predominantly, we know that Aedes aegypti do spread dengue, but then albopictus also is a vector of dengue as well. And not only that, Zika and chikungunya. Yeah.
Chikungunya.
Yeah.
And that has been on the increase as well, or has that been steady?
And for Zika and chikungunya, the numbers of Zika and chikungunya have not increased. We know that it tends to go in coordination with dengue fever as well, because as I've mentioned, they're spread by the same mosquito. So they all sort of go in concert. Huh? But what Aminiasi is saying is that the prevention for all these diseases is exactly the same. It's about firstly reducing the population of the mosquitoes that carry these diseases, which is all this source reduction that he's talking about, and getting rid of mosquito breeding places. And the other thing is preventing yourself from getting bitten, which is about using mosquito repellents or using bed netting, for example. Huh?
And if you could give one advice to the viewers watching now at home concerning dengue fever, what would it be?
Oh, I would recommend that the cleanup for dengue fever should become a routine part of your household cleaning. So as you are cleaning every day or every week, you need to keep in mind that you also need to be getting rid of the breeding places for dengue fever, and just make that a routine. And that's the best way you can protect your family from this awful disease.
I want to thank you, Dr. Alicia and Aminiasi, for coming tonight and talking more about dengue and what we need to do. Dengue fever is a disease that we are very familiar with and one we can control if we remember not to litter and work together to clean up our yards. Prevention, after all, is better than cure. Hope you enjoyed the show tonight, and from the team and I, good night.